how many states will go back into lockdown?
I can't tell you exactly how many, but I think we're seeing the beginning of that right now in Texas, Arizona, and Florida, among others, reversing some of the initial decisions that were made too hastily to reopen and rethinking the idea that young people are invulnerable to this disease.
So, Joshua, what exactly happened? Did we open too quickly in certain states, or did we open badly in certain states?
We opened too quickly. I mean, it was obvious. Even the White House guidance wasn't being followed. The White House guidance was the number of cases should be going down. Things should really be moving in the right direction, and that capabilities to respond to outbreaks should really be in place before you start reopening, particularly before you start reopening, each level one on top of the other. But the states just plowed forward, and there was sort of a moment where governors just felt like, this was the right thing to do. The virus was just sitting there ready to do its thing, and that's what the virus has done. You get people into bars, and the virus is going to spread quite a bit.
I mean, we understand from the U.S. Health Secretary, Alex Azar, that the window is closing on halting the spread. Is it too late? What measures need to be put in place now to get a handle on the situation?
I'll be honest, I'm not sure exactly what Secretary Azar is talking about. I think he should have been much more vocal when these states were doing the wrong thing. I think the federal response in terms of communicating clearly about what is happening, what needs to be done, and how to fix this has just been terrible from the beginning. It's been way over politicized. We haven't heard from the CDC. So, my view is that, yes, we can get a hold of this. There are things that every, country that's been successful has done, and we just have to focus on doing them.
Dr. Sharfstein, how do you reopen correctly? So is it the R number, this famous R number, that needs to be below, 1 to at least measure how many people are getting the disease by one person? Or what metrics would you look at to reopen?
That's a hard number to calculate in real time. It's sort of calculated best looking backwards. So you really want to have a dashboard of critical outcomes, the number of positive tests, the percent of tests that are positive, the number of people in the hospital, the number of people in the intensive care unit. And you want to see that they're very clearly going down. And then you want to open slowly. And certain things, we're learning, and the world is learning, really aren't that safe to reopen. So you're never going to get to completely open until we have a vaccine and can really control the spread in those, intense indoor settings.
Okay, are there states that are getting it right?
Well, there are states that have, really locked down, controlled the spread, but now are starting to reopen. So the right question is, have states been able to reopen without having this big explosion of cases? And it's a little too early to say that right now. We're seeing certainly pretty good control in the Northeast now, Rhode Island, Massachusetts, even New York. But the key is going to be, as those states reopen, whether we can stay vigilant, whether we can reopen slowly, not just reopen everything, whether we can take precautions, and whether individuals will also take precautions in their lives.
And this is about, flattening the curve, saving lives, and they're carefully reopening. When you see the resurgent number of cases in certain states, will it influence how other parts of the country behave?
That's a good point. I think hopefully it will. There's just been an incredible ability that places have, countries as well as states, to say, what's happening over there, that's not going to happen here. I mean, time and again, we've heard that, that's not what happens in Chile, or that's not what happens in Texas. And sure enough, the virus is the same, and it does happen. And so it's really important for the states that have now, overcome their initial surge of infections to realize it could well come back. Not that many people have been infected on a population basis. There's still plenty of opportunity for this virus to move around, and, vigilance is absolutely required. I really hope that the federal government can get on a clear and consistent messaging platform and re-empower the CDC to lead the nation through this.
Is mask wearing important? Should it be mandatory in public places across the country?
Yeah, the evidence is definitely there that mask wearing reduces the spread, and it's just gotten stronger over time. So when people are indoors in businesses, when they're near people, it's a very good idea. So I think it makes sense to mandate it, and I think that it's a very minimal imposition for potentially a huge positive health impact, and I think that's why you're seeing even the vice president endorse it. The problem is, after months of conflicting signals, it's much harder to get that message across, and it's time that people realize how much is at stake.